So there's London, there's Paris, and it's up on the coast up here. So he starts off at this institute, and so the treatment back in those days for scoliosis that got to the point of requiring surgery was pretty terrible, to sum it up, back in those days. Basically what they were doing was surgeries without instrumentation. So to try and put it up quickly in lay terms, the patient bone fragments are taken from either tibia or the iliac or your hip, and the patient is manipulated as best as possible to try and straighten them out, and then the bone fragments are placed between the vertebrae for fusion. The patient is wrapped up in a plaster cast, and for a long time, like a year, or it could have even been longer. And then the cast is removed, and the correction was very unsatisfactory as well. Then in the 1950s, in the United States, a doctor invented instrumentation called Harrington rod, and Harrington instrumentation, Harrington rod. And so that's it seems like that's the one people have actually heard the most about whenever I tell this story to somebody. But that came around in like 1959, 1960, and that was the first instrumentation that was used, and that improved degree of correction that they could get surgically, but it couldn't correct three-dimensionally, and the patient would have to spend still a long time in external support, plaster cast, bracing, etc., after the operation. And I could show, I'll use my belt so to try to explain this. So with scoliosis, okay, so if you're looking at the spine like this, and so you'd have a lateral curvature. So that's what most people know when they think of scoliosis, but it's a three-dimensional abnormality. If you look at the spine from the side, so the person is facing this way, the back is that way, what you'll have in a normal spine would be a kyphotic curvature in the upper back, and try to hold this, and a lower and a lordotic curvature in the lumbar spine. And typically in a normal spine, this degree of kyphotic curvature will be between 25 to 35 degrees. And what typically happens in a typical case like what I had, of a right thoracic idiopathic scoliosis, is this will flatten out and you lose the normal kyphotic degree of curvature. So there's a lateral curvature. You're also losing your normal degree of kyphotic. From the lateral view, the spine is basically flattening out. And there's also a rotation as well of the rib cage. So there's three dimensions to the condition. The Harrington rod basically acted what you sort of might call it an auto-jack type system. So it basically took the two ends of the curvature and, like an auto-jack, kind of pulls it apart. So when you're looking at the lateral curvature, you would see, okay, well, I would see why that would help. But when you look at it from the side, and the problem is it's too flat, and you're trying to get a normal kyphotic and lordotic curvature, you can see pretty easily why taking it from the two ends and pulling it apart is going to do nothing to solve that problem, and really actually could make it worse, because if there maybe you have some degree of kyphotic curvature, and now you would even make it flatter. And you would also have no ability to get derotation. You're correcting one dimension of the three-dimensional abnormality. So that was the Harrington system, and that was the gold standard through the 1960s, the 1970s, and up until Dr. Cotrel came along with his instrumentation. So back to Cotrel's story. So he started in the 1940s, and for 30 years, basically, he traveled the world, through Europe, into Russia, and he did a 6-month advanced study in the United States in the 1950s. And then in 1975, he had 3 heart attacks, and was rendered, he couldn't, he disabled in terms of being able to do any further surgery. So then he basically was forced into retirement as a surgeon, but he was only 50 years old. And so in the years after in his recovery, after 1975, he was getting relaxation, rest relaxation, out in a cottage in the countryside of France. And that's when he began to try to brainstorm and think about if he could develop an instrumentation system that would correct all 3 dimensions of the abnormality. So he began working on that in 1978 and worked on it for 4 years, drawing sketches, and at some point getting in contact with an engineer to help design the potential instrumentation. And finally, after 4 years, from 1978, in the fall of 1982, he had his first prototype. And here's a picture of that for a system that would give a 3-dimensional correction of the abnormality. So at that point, in the fall of 1982, he goes, what he needs at that point is a reputable, outstanding surgeon to take an interest and want to do an operation using this instrumentation. So he recalled a colleague that he had known years ago in Paris, a Dr. Jean Dubosset, and he went and he showed him the instrumentation. And Dr. Dubosset was immediately impressed with the whole thing and thought it had tremendous potential. So at that point, they set up a first operation very quickly. That was in about December 1982. And then January 1983, they did the first operation using this instrumentation system. And an additional benefit, it gave 3-dimensional correction, and I'll explain in a moment how that works. But it also provided such a stable